Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Welcome. Today I'm going to discuss 3 facts about tongue tie that all breastfeeding babies want you to know. This episode is mainly aimed at professionals. I'm going to discuss information that clears up popular myths about tongue tie so that you can better serve the infants in your care. But if you're a parent, the topics will also assist you to understand your own baby. So breastfeeding is universal, and unfortunately, breastfeeding struggles are as well. In many ways, this topic is about coming together not only geographically, but professionally as well. I always welcome professionals from many different fields to come together to learn. It's not often that we have joint educational opportunities. We are usually in our own silos, using slightly different lingo, and don't often know what the other members of the team are doing. You may be a nurse, a doula, an MD, a DO, a dentist, a lactation consultant with many different initials, a childbirth educator, an SLP, an OT, a PT, etc. Please don't be insulted if I forgot you on my ever-expanding list of team members. We may all have different roles, but most of us are all in what is often called the caring professions. We are helpers. We believe in breastfeeding and want to support all the dyads that we meet and get frustrated when we can't. And when I say support them and that we believe in breastfeeding, I don't mean that we have to support those in our care to meet the goal of exclusive breastfeeding. I mean that we need to support families to reach their own goals around infant feedings. During this episode, you will learn 3 facts to quell the myths that are commonly heard about tongue tie. And you'll hear about an opportunity to join my professional course called A Professional's Guide to Tongue Tie in the Breastfeeding Infant. So definitely stay tuned till the end for that. Have you struggled with knowing what to believe about tongue tie and breastfeeding? I don't blame you. There is so much information and misinformation on this topic. You want to be able to help all parents to reach their goals, but maybe you're not sure that suggesting tongue tie is the right thing. You've heard of babies who are helped by the procedure, but then you've also heard about those who haven't been. No one wants a baby to have an unnecessary procedure, right? I know I don't. I'm going to be completely honest, though, and say that I'm ashamed of the number of professionals that say they support breastfeeding, but haven't invested any time to really learn how to manage the struggles that can occur. I grappled with these issues as well. Just like you, I truly wanted every breastfeeding dyad to succeed. But I was a midwife who didn't like to recommend interventions. Honestly, I was conflicted for a while. There were babies that I just couldn't get to latch comfortably or nurse efficiently, and I started to get curious. Finally, I took a deep dive into learning all about tongue tie and breastfeeding. I attended conferences, joined professional associations, started reading the available research, and networking with and shadowing pioneers in this field. I still remember the first baby that I sent for release of tongue and lip tie and how well they did afterwards. There was no turning back. If you are like me, if you are like I was, and you want to have the best information and protocols for those who look to you for support, information, and care, then you are in the right place. It's one thing to support breastfeeding in theory, but we have to know how. And I've given up the idea that this is just a problem to be addressed by IBCLCs. Truth is, most families never see an IBCLC. Before we get to the 3 facts about tongue tie that all breastfeeding babies want you to know, I'm going to share with you the goals that I outline in all of my outreach about oral restrictions. Number 1, I want you to be confident in your knowledge with up-to-date facts about tongue tie. Number 2, I want you to be able to assess within your scope of practice. And number 3, I want you to know how to implement or support effective treatment plans depending on your scope of practice. Can you imagine what it would feel like to have solutions for more parents and babies and knowing that they reached their feeding goals because of you? For me, and perhaps for you, learning about tongue tie meant that I'd have the confidence that I was lacking, and I'd be able to educate more families and support more babies to successful breastfeeding. In short, we'll all have an impact on our world. Okay, so ready for the 3 facts about tongue tie that all breastfeeding babies want you to know? Fact number 1, there is no such thing as a slight tie. Slight in air quotes, if you could see me. First, let's just go over the definition of a tie or a tethered oral tissue. And if you want more information about what we refer to as TOTS, my first episode has a great breakdown of all the definitions of tethered oral tissues, or TOTS, T-O-T-S. So you can listen to that episode too. So the definition of a tie is an abnormally formed or tight attachment in the mouth that prevents functional movement. We see parents always posting pictures on social media and asking, is this a tie? Every day, no exaggeration, I had 4 today. I hear from families who have been told by their pediatricians, midwives, nurses, and lactation consultants that their baby only has a slight tie. Perhaps you've said this to a mom or dad. That's okay. I used to say this too. But if we go back to that definition and realize that being tied is an action or a function, then there is absolutely no way to tell from a picture or from a quick oral exam. Those who come through my course, A Professional's Guide to Tongue Tie, tell me that the assessment module is the most eye-opening for them. We go into detail about types of frenum and how they affect breastfeeding. We also learn how to do a functional assessment with or without an exam, depending on scope of practice. Measuring the function, often by signs and symptoms, is key to whether a frenum is restricted. So, key takeaway from this first fact that there is no such thing as a slight tie is that many infants with oral restrictions will be dismissed by pediatricians and other members of the team, sometimes even other lactation consultants. These infants need you to advocate for them if their parents are to meet their breastfeeding goals. Okay, so 3 facts about tongue tie that all breastfeeding babies want you to know. Fact number 2. An infant who is gaining weight fine can have a tongue tie. Yep, it's true. We are so weight obsessed in our culture, at least here in the U.S. And this starts from birth, right? Often our only measure of well-being is weight. For infants, we think that all is well if they're gaining enough. For adults, we worry we are gaining too much. Not sure where the shift happens between the two, but I digress. In my experience, weight gain is not an indicator of an oral restriction. Now, that being said, there are many newborns who don't gain due to inability to latch and nurse efficiently, and tongue tie may be the reason. And there are many failure to thrive or slow to gain due to tongue tie. But in my practice, believe it or not, I meet almost as many chubby babies with tongue tie as I do underweight babies, because weight gain is only one of the parameters of breastfeeding success. I actually have a hunch about chubby babies and tongue tie, and maybe you can be on the lookout for this in the infants that you see and let me know what you think. I see mothers oversupply sometimes as a compensation method designed by nature to help infants who struggle with oral restrictions. In other words, when an infant has trouble with the movements needed to extract milk from the breast, the milk becomes easier for them to extract, and then they get more of it without having to work very hard. So these infants are gaining weight easily. Again, just a hunch, but it makes sense to me from a biologic perspective. It's something to ponder. So key takeaway from fact number 2, an infant who is gaining weight fine can have a tongue tie, is if there are other signs and symptoms of tongue tie, especially maternal nipple pain or damage, even if infant is gaining, infants need you to understand that weight is not the only factor to evaluate. Okay, so fact number 3 in the 3 facts about tongue tie that all breastfeeding babies want you to know. Most babies with tethered oral tissues need much more than a little snip of their tongue or lip tie. This may be the most important fact that breastfeeding babies need you to know. This is so much more than a procedure. Realizing this will differentiate you and your practice. I used to think that the procedure to release the tie would solve all breastfeeding problems. I wish it did, but it doesn't. And believing it does may be what gives this field a bad reputation and skews results. Families who are sent for frenotomy, which is the procedure to release the tie, or go on their own without professional evaluation and a holistic treatment plan usually have suboptimal results. I have 2 messages just today in my inbox. One is, my baby had it snipped 2 weeks ago and nothing got better. Or the sadder one that I got this morning, my baby never latched again after having his tongue tie clipped. Think about this for a minute. If a tie looks bad or dramatic or obvious, I'm not sure what the opposite of a slight tie would be, then after the procedure, when it looks like there is no tie, everything should be perfect, but often it's not. Many of you have heard negative things about recommending tongue tie treatment. Maybe that it doesn't work, or it's unnecessary, or that it's being overtreated, etc. In my experience, many of the failures occur when there is just a little snip or no preparation or aftercare is provided. What I know for sure is that families who are treated with a team approach have successful, supported outcomes. My protocols and the team approach work. There is more success when professionals work together. I'm a fan of the team approach to care for all breastfeeding infants. An entry into the team can occur anywhere, and different dyads need care from different team members. The exact route through this pathway may vary, but all therapies need to be considered to provide infants with an individualized approach and a chance for maximum functional results. You may be a nurse, a doula, an MD, a DO, a dentist, a lactation consultant, a childbirth educator, an SLP, an OT, a PT. Whatever your role, we need you on this team. Babies need you on this team. The key takeaway to fact number 3 is that the TOTS team approach is vital to successful outcomes, and infants need you on the team. Why am I so passionate about tongue tie education? Because parents are not being supported and are not meeting their breastfeeding goals. For parents who don't know, young parents are hanging out on Instagram. 2 of my most popular posts on Instagram are about missed tongue tie. Every time I post on this topic, I get hundreds of comments and messages. They list all types of providers who missed their ties, professionals who had no solution for them. Families trust us as professionals, and we have to know how to help. You may be saying, but Lisa, what do we do about this? I have a plan. If you are not confident about tongue tie and breastfeeding, right now you may feel overwhelmed. I know that I used to. You want to make an impact, you have good intentions, but then you get stuck. You need a roadmap and treatment plans, and perhaps a community where you can discuss cases, feel supported, and find referral partners. This is what is happening inside our course, A Professional's Guide to Tongue Tie in the Breastfeeding Infant. The course is a multidisciplinary program with proven protocols and treatment plans to guide families within your scope of practice. I'm going to link to the page with all of the details in the show notes below in case you are interested. It's at tonguetieexperts.net/pro-course, but the link will be below for you to click directly. This version of the program is always available, but if you are listening at the time of the release of this episode in spring of 2022, it's now on sale at the lowest price it has ever been. And there is a coupon code. You can use the code SECRET100, and SECRET is in all caps. But again, that'll be in the show notes. If you're wondering what the course includes, it includes 4 video modules and a packet of done-for-you educational materials for your own use or to share with your clients. It also includes membership in a multidisciplinary private community to share, collaborate, and network. You'll learn all about assessment, treatment plans, the procedure to release the tie called frenotomy, and aftercare, all within the scope of practice of your profession. And if you happen to be a doula, please message me. The link will be below because I have a special discount just for doulas, just for this week, because this is World Doula Week. Happy Doula Week to all of you doulas who do such important service to the birthing community and to women all over the world. Thank you. If you are an IBCLC in search of LSERPs, the live version of the course may be better for you than this version. If you're on my mailing list, you'll be notified when that is available. If you're not on my mailing list and you want to be, the link will also be in the show notes. No matter your role on the birth team, families need your help to reach their goals. You may be the only caregiver that they see that will not dismiss their concerns, their symptoms, and their instinct that something is wrong. I know you want to make a difference in your community. It's my hope that we can do that together. If you're interested in signing up for a professional's guide to tongue tie in the breastfeeding infant, be sure to see the links below. As always, thanks for listening to the Tongue Tie Experts podcast, and thank you for all you do for families. See you next time. Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Please subscribe to us on your favorite podcast app. If you enjoyed what you hear, we'd love it if you'd rate, review, and share with your friends. Check out the show notes for useful links about the topics we discussed on this week's podcast. Also, you'll find the ways to follow us on social media. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.